Hi there, welcome back. I have Dr. Kennard here with me. My name is Brittany, and today we are talking about the hottest craze, and that is the GLP-1s. It is taking the nation by storm. How are they effective, and how can cannabis complement the patients using it? So without further ado, I'm going to pass it over to Dr. Kennard, and he's going to dive pretty deep into these GLP-1s and just show you how effective it really is.
Thank you, Brittany. Glad to be back and glad to have a fresh topic. I know it's a topic of interest. We didn't have to take a poll. In the field of medicine, this may be the closest thing to a revolution since penicillin. I mean, that's not an overstatement. It's a big deal, and as a medical person, I have kind of waited in the wings and been real careful to make sure that we're not sitting on a ticking time bomb, that we're going too fast and getting ahead of our feet. I'm pretty comfortable with where I am on it, comfortable enough to kind of talk about it in a way that almost promotes the use of it. And that's not something that's easy for me to do, but it's easy with cannabis. You've heard me talk about it a lot. If you don't believe that I truly believe that this is a good thing to use as a medicinal, then I'm not sure I'll ever be able to get through to you. Yeah. So on these GLP-1s, so glucagon-like peptide is what it stands for. You never have to hear that again because it doesn't even mean that much to people that didn't just research the drug. It is a class of drugs that has a novel mechanism of how it works in your body. And it was originally studied as, to see if it was effective for diabetes. And in those trials for diabetes, they saw profound weight loss. Okay. Therefore, they restudied it for weight loss because that's how the FDA approval process works. You can't just say, well, it also did this, so give me approval. Your approval for your drug has to be part of your original hypothesis. I think semaglutide or semaglutide, however you want to pronounce it, could be an effective drug for diabetes. Here's how I'm going to study it, and then I'll give you my conclusions. Yeah. So once you've said that, you can't start adding, even if it's really positive, but what you do is quickly go back and study it for the other indication and get it approved. So now here's where we are. Most people would recognize Ozempic by its brand name, Mounjaro by its brand name, Wegovy, Trulicity. Those are probably the four on this panel that are have name recognitions because they've been out long enough. But the issue is with your insurance and the indications are slightly different. So even though semaglutide Ozempic is technically the same thing as Wegovy, number 1 and number 3, they are semaglutide, same chemical. Those pharmaceutical companies studied one for diabetes and the next one jumped in and was first to study it for weight loss. So they have FDA approval for separate indications. So if you're diabetic, your insurance company is not going to pay for Wegovy, even though they're probably doing the same similar thing. And the reverse is true. If you need it for weight loss and Ozempic is cheaper on your plan than Wegovy, it's a no-go with your insurance. But that's a whole different shell game that you have to play with your insurance. The bottom line is the drugs have been out now 5 years or more for diabetes for sure, for weight loss close. And the effectiveness versus the risk to you and your body and complications is so drastically opposed that it's hard to deny their popularity and use. So there is a proper way to do it, and there are barriers you need to meet to be eligible to be on them for weight loss or diabetes or both. And we'll talk about that a little bit, but that's what the drugs are. and where we are with them. And recently in Mississippi, the licensure board approved the use of compounded forms because there's a shortage of these injectable drugs, the branded.
Wow. So it's so popular that there is currently a shortage.
That's correct, of the branded drugs. So compound pharmacies can get the base ingredients and compound it outside of the FDA approved process to make the branded drug. And with that comes a little uncertainty. You need to source compounding company, pharmacy, and make sure that they're making it in a sterile, safe way, and that it is what it says it is when it's shipped, because it is not FDA approved under those circumstances.
The compounding is not
the
FDA.
Compounded form.
But
compounded
this is like the injections are FDA approved.
Well, the injections, but the compounded form is also injected. So what Paws is doing is a compounded form for patients that insurance, the cost is prohibitive or it's not available, right? It's just not available because of the shortage. So we're allowed to offer the patient a compounded form, and typically that's a better price point for them. But also generally, the most common forms are the injectable, and it's a once a week injection. And what the typical results that you see are anywhere from 10 to up to 30 pounds of weight loss in the first 30 to 45 days.
Wow, so, 10 to 30 pounds in the first 30 days. That is almost unheard of.
Yeah, and that's without changing anything else that you're doing. So let's talk about that. If your insurance is going to cover this, and technically if you're going to get a compounded form, you need to follow some medical guidelines. You don't just run around injecting people with stuff because it's popular. That's not how medicine should work. So yes, you have to be obese to use it for weight loss. So you have to be a BMI of 30 or more. And BMI is just a little simple calculation of your height versus your weight. So your doctor can do that. Any clinician can do that. You can do it yourself on a scale if you know your height. You can go down to a BMI of 27 if you have other risk factors like heart disease, metabolic disorder, fatty liver. It's even reversing fatty liver. So you can hedge downward to 27 if you have one or more of these things that it's shown to also help outside of the weight loss. So you need to meet that criteria, and typically there needs to be a documentation that you've tried the common means by which people are known to lose weight: exercise, diet, portion control, all of those things. But most people have done these things and can honestly report that they've tried. It's not they didn't wake up obese today and go into an appointment Thursday and say, well, I've suddenly just got this obesity. Well, what have you done about it? Well, not much. Okay, we'll give you this injection. I mean, that's not how it goes. So yes, there are criteria, but actually a BMI of 30, especially in our state, is not. A lot of people have a BMI of 30 that would not consider themselves overweight.
Yeah, absolutely. And I just did a quick Google search while we're here, and I just said BMI calculator, and there, I don't know if you can see that screen too bright, but it's just a simple calculator with your height and your weight, and then it will give you your BMI.
Yeah.
And 30 is not a lot. I would say a lot of people would be surprised that they do qualify for those conditions of 30 or more.
Right. Now, so then it becomes more of a personal decision about what you want to do with your body. But on the polar ends of that, there's someone that might want to lose, 20 pounds because summer's coming up. Okay, that's their motivation. It's fine. There's no harm, no foul. Whether they put an injectable medication in their body or not would be now more elective, but they could still meet the criteria.
Yeah.
I wouldn't probably support that like wholeheartedly, but if you've tried everything and it's really important to you, and the risks and benefits have been weighed by you and explained to you, then it's freedom of choice at that point.
Yeah.
So that's one end of the spectrum. The other is you are obese or morbidly obese, and it's going to affect your health and your longevity for sure, because we know that. We know obesity stresses the heart.
Mm-hmm.
It stresses the bones. It causes many downstream complications that affect people's quality of life. And so that's what the drugs are really exist for, but they are everywhere in between that can be used. So.
Now, say that person who wants to lose weight just for the summer, right? Would that be, approved for them to have that short-term use of the product? And, the question would be, how do they know when they need to stop? And then once they stop using it, what happens next?
Great question. And that is a common one. And you need to know what the data has shown about that. So the studies, most drug studies have a cutoff point where they stop the drug, and whether it was needed anymore, or was curative, or they just have to have an endpoint. And what happens to what they were treating when it stopped? You want to know that, because you'd not think that you have to take something for the rest of your life if you don't have to. What we've seen is that you are guaranteed to gain some weight back, and you may gain all of it, and you may gain beyond where you were when you started when you stopped it.
Oh no.
Yes. So what we've done with the generalized recommendations from medical professionals and societies is, since it's been out long enough and we've been able to study it long term, there doesn't appear to be long-term complications. So the indication just to stay on it, if your goals are still being met, it's okay. So I always liken it to, if you're depressed because your body doesn't produce enough serotonin, you have a serotonin deficiency as the cause of your depression. You take a medicine to boost your serotonin, you're unlikely to ever be able to come off and expect it to just stay there. The medication was the reason that the serotonin equalized. If you have high blood pressure and it just runs in your family, and you try to diet and exercise and you just have high blood pressure or cholesterol, your genes are determining that a lot of the times. And when you get it lowered with medication, you hardly ever just come off. We got it fixed, so now you can stop it. I would just think of it that way. Now, it being a weekly injection, they're going to come out with more practical regimens if this continues to be safe. There'll be ones with less side effects, maybe monthly injections, maybe it's a pill form. There is one pill form actually now that's daily, but it's only indicated for diabetes. And so if your doctor wanted to prescribe that for weight loss, they could, but it would be considered off-label is the term, and that there's some risk in that for the practitioner because it wasn't studied for that.
Yeah. Now, say they're taking, the weekly shot, the weekly injection. I think injection is more of the nicer way of putting it. Right? So, are they going to continue to drop weight? How does the weight then become manageable? Say they hit their achieved weight, they don't want to gain the weight back, so they continue on the injection. When does the weight start to stabilize?
That's a great question, and where we've seen it is around 30 pounds of weight loss, and that all happens, I said, in 30 to 45 days. So it's not this linear loss of weight that you just shrivel up to nothing. I mean, obviously you wouldn't want that, and a lot of people will test, instead of just coming off of it, they'll stay on the dose for a little while, and then they'll, what we call, challenge it. by dropping it a little lower and see what the lowest effective dose for them is. And then at what point did they start to get their appetite back and gain weight, and then you stop there. That's the best management strategy. When you start, you should probably stay on the starting dose for at least 30 days, because what we've seen in our experience now, if you give it a little time, the starting dose will catch up, and you may take you a little longer to lose the weight, but now you don't have to change anything. You're on the lowest dose and you met your goals. You don't have to do this, let's go up. I'm antsy. I want to see it go. And then you get some of the common side effects like nausea and vomiting. And then you kind of make yourself a little sick, and stay on that first 30 days and then challenge it by going up a little bit if you're not meeting your goals but not having side effects. That's the way you manage it.
That's great. Now, what would happen if they were to skip doses? Like, say, instead of doing it every week, is it possible that they might do it every other week, or they take a month off if they, if it's money that they're worried about or something changes with their insurance? How does that affect the body and the weight?
Yeah, I mean, the human body is very sophisticated, but one thing we know for sure is it likes consistency. It likes you to go to bed and wake up at the same time, and there's a lot of hormonal regulatory mechanisms that depend on being consistent.
Yes.
This would be the same. So yes, you can challenge it by stretching it out, and more power to you if you're able to do it every 2 weeks and maintain the same benefits. But that's something you work out with your practitioner and their comfort level with it. The more likely thing is that you allow your body to readjust back down to closer where it was before you started, and then you're kind of starting over again. With this drug, I would suspect that, and I think people that have tried to challenge it and come off, that have rebounded and gained their weight back, have kind of proven that to themselves. They were on the lowest effective dose, and you don't, unfortunately, it's not curative. Boy, it would be even more popular if the weight stayed off and you only had to do it 1 month. I mean, it's already a drug shortage over it. I can't imagine the drug shortage if it was curing weight loss. However, people wouldn't need it past a month, so there'd be more available. Talk myself out of it.
Well, I'm gonna get back to some of the benefits here, and I'm gonna pull up an additional chart. And I think it's important to show that it's doing more than just helping you lose weight. So can you walk us through, what are some of the other additional benefits?
So as we've covered the FDA-approved indications, which are blood glucose control for diabetics, type 2 diabetics, and weight loss. We have found, incidentally, like we found the weight loss through the diabetic studies, that patients with fatty liver, the bottom right, like at the 4:30 position, 5 o'clock, it decreases inflammation in general in a lot of organ systems, but in the liver, inflammation in the liver is what causes an increased deposition of fat. So fatty liver usually starts as an inflamed or irritated liver, whether it's alcohol intake or just metabolically. Some people just get fatty liver, and they live perfectly normal lives and take care of themselves, and they just have fatty liver. There's inflammation in there, and it tends to decrease that inflammation and removes fat deposits. That's very beneficial if you have fatty liver and you were already doing everything you were supposed to and you just had it. It's very unfortunate when somebody's actually doing all the right things, and then it's like cancer. It's so fortunate that you get lung cancer and you've never smoked in your life and done all the right things. It's just the saddest thing. Cardiovascular wise, so blood vessels run through your whole body, every organ, every muscle, every bone, and your brain. Keeping them clean on the inside allows the blood to flow through better and deliver oxygen and keep everything healthy. Plaques that develop inside the vessel block that, impede that at some point in your life that can impede it enough to where you have a heart attack or stroke. That's what causes it. Lack of blood flow. Well, the same anti-inflammatory effect theoretically is happening there, and that's how plaques get deposited in your arteries, because they're attracted to inflammation. The cholesterol deposits are attracted to inflammation in the blood vessels. And when you decrease inflammation, you decrease the plaque. We're seeing this. It's a beautiful thing. It's amazing. It can't be fully explained yet, but it's not denied. And it's picking up steam. And so I see the indications for these drugs expanding well beyond diabetes and weight loss. For instance, you're a 6 foot, 160-pound male, you're not overweight, and you don't have diabetes, but you have bad cholesterol in your family. It's a bad place to be. And some people cannot tolerate the cholesterol lowering medications, statins. Well, there will probably be an indication for GLPs just for that. Not one yet. And so our clinic will not put you on these for anything but what's FDA approved. We're not going to use it off label for that until it becomes more of a standard of care. But it's very exciting. I don't know what else to say, but I'm an anesthesiologist, pain guy, and I'm excited enough to have learned that much to tell you. But I have intern friends, internal medicine, family practice. I know how to read a study, and they are all saying the same thing. I'm just echoing the excitement of the medical community.
Yeah, absolutely. It sounds very exciting. And, I also hear that there is some complement to cannabis patients as well, if you are considering or are on the GLP-1s.
Yeah, so weight loss in cannabis is a stretch for some people to make anyway. And so I'd like to explain why Paul's Pain and Wellness, who's a dedicated cannabis certification company, would entertain weight loss. Did you just know it was popular and you just wanted to pop it in there and let's go? It's in high demand. People want to lose weight, and medical weight loss programs are successful. But cannabis, in the research that we've looked at and the patients telling us, some of them have actually been able to stop some of their oral anti-diabetic medications. Again, it's not fully explained in the literature yet, but it's happening. And we think it has to do with improving their insulin resistance, or decreasing it. So that obviously is a health benefit. And stress hormones. So if you're stressed and you don't get good sleep, your cortisol level in your blood is higher, and that is a metabolic hormone that controls appetite and weight. And so if you decrease that by the cannabis decreases your stress and improves your sleep, you're going to decrease your cortisol and may lose weight. So, and you're not selling it as a weight loss mechanism, because people would argue, well, I thought it made you hungrier. Well, certain strains do, but what we found, and it's not just me, I enjoy and I implore you to fact check. Please Google yourself until you're silly, because that's how I'm getting the information. I'm not just pulling it out of the air. They did long-term studies on cannabis, long-term cannabis smokers versus non-cannabis users. Unequivocally, the weight circumference of long-term cannabis users, smokers, daily, is statistically significantly lower than non-users. Less. Their waists are smaller. Thousands, hundreds of thousands of patients, not just a few. So you can deny that all you want, but it's right there in the literature. Go look up the studies. I like to just tell people, do your own little study. Think of all the people that have used cannabis around you, potheads, whatever you want to call them. Put a moniker on it. stoners. Think of them. Just collectively take 5 seconds to think of them all sitting in a room together. What's there? Are they overweight, obese? They're usually little people. They just are. They're usually skinny.
It's so funny that you say that, because I'm
not?
thinking about all of the people and throwing myself into that category as well. And yeah, you're pretty spot on with that. And it's something that I haven't, put two and two together my entire life. But I also think it's strain dependent as well, and,
It is.
and if you're taking an indica rather than a stevia, like it's going to feel different, right? There's going to be some that make you want to be more active, and maybe it's curbing the appetite. And then there's some that are going to make you want to sink into the couch and munch out. So I think it's, working with the pause team and finding out your dosage, finding out how it can complement your lifestyle. And, at the baseline, there's so many other benefits to it as well, too, while you're shedding the weight. You might have side effects. You might be in pain if you're increasing your movement. You might have a disruption to your sleep, as you said. So it's just going to complement everything else that your body is shifting through, because losing that amount of weight in a month, there's going to be some figuring out your body is going to be doing. So it's just kind of like your comforting friend there while you're going through a big transition.
Right. It's a great point. We pride ourselves on individualized care. So I just painted a broad picture, but we're going to look at your circumstances and your goals of treatment. I mean, if you come into us and you say, I've been using cannabis for 5 years and you're not obese, there's no sense in talking about the fact that it could increase your hunger and make you gain weight. It hasn't done that. So let's move on. Mm-hmm. Right? We're not seeing that as a problem with cannabis use, that I gained so much weight I had to stop using. I've almost never heard somebody say that. So because they're using it medicinally, it's helping them in so many other ways they can take, and they're not going to gain 60 pounds because their appetite increases a little bit with cannabis. Just like you're not going to guarantee to lose 150 pounds because you use one of these injectables.
Right.
The average weight loss, I believe, is around 20 to 30 pounds. And then you don't just keep increasing the dose and keep losing more. You can't dial it in like that. Mm-hmm. You need to look at your specific situation, the indications for you, and your goals of treatment, and then we follow you and try to meet those in a sustainable way. So yeah, I mean, I don't think you come into our clinic and you go, all right, I want to lose weight. Should I do cannabis or should I do these popular injectables? It's really not. It's not like we're not trying to make that decision or ask you to make it. Most people are using cannabis, getting the medicinal benefit, whether they gain or lose a few pounds. If you're obese and it's a threat to your health, you may need to go to the next level. We're just providing that next step for you. You built a relationship with us. You're comfortable with it. We can manage the cannabis while you start this new drug, all in one setting, and keep it tight. Loop of communication, your comfortability. You don't have to go different places to get different treatment. That's exactly why we're doing the behavioral health offering that we do, because we'd rather a practitioner help you through your mental health struggles, but be the same one that's guiding you through the implementation or continuation of cannabis treatment. Having that one person and one source to be able to sort that out with you is key. There's nothing lost in communication when you do it that way.
And a breath of fresh air. I mean, I can personally have a testament to how exhausting it can be. The doctor, you go for one thing and they give you a referral to another one. And it's not like the doctor's calling your referral. You got to call the referral. You got to track them down. And then you get to that referral. If you don't find the answer, well, you got to go to the next referral. But knowing it's centralized in one area, and there's some connections to what everything PAWS provides as well, too. So it's not like you're offering services that are coming out of left field. I mean, cannabis helps the whole body, and the entourage effect. Like it's the holistic aspect of the plant and the body and the mind. And then you have your mental health and you're also your physical health. So you're just bridging the gap between it all. And you're not exhausting resources doing it. It's all in one place.
Well, some people don't see the forest for the trees. Sometimes I don't see the trees because I'm thinking about the forest. You directed me to look at the name, the logo in the top right of the screen. Yes, it has a figure that resembles a marijuana leaf. It's not one, by the way. Anatomically, it is not the structure of a marijuana leaf. It has a pulse symbol in the middle. Okay, some people may not have picked that up, but it says pause, pain, and wellness.
Mm-hmm.
We're here to make you well. We want a holistic approach. Weight loss can make you well. It'll improve what we've also seen besides the physical benefits and the cardiovascular benefits and all of that stuff. When you meet your own health goals, it gives you confidence. It feels good.
Mm-hmm.
That's important for the psyche part of this, to have confidence and feel good about yourself. And so if you're taking cannabis because it helps you sleep, or you have PTSD, or you have chronic pain, we're going to talk about that. If you're not well because of struggles with your weight, that's just as important too. It's just because it doesn't fit in the exact mold. So, when I founded the company, I added wellness because I could see the interweaving of how cannabis, the goals for cannabis treatment sometimes aren't met.
Mm-hmm.
Well, that's a sad situation, but do we have to just stop there and say, well, I'm sorry, it didn't work? I don't think that's good enough. I like to force the issue to get you as well as you'd like to be.
Absolutely. Think good, be good, feel good. Well,
Yeah.
thank you so much for this very informative. I personally learned so much. I hope our audience also learned as much as I did. And if you have any more questions, you can reach out to Pause. We got lots of information on our website about the different injections and the different brands and how to incorporate it into your life. So feel free, Pause is here. We're here to answer your questions. And thank you so much for joining us.
Yeah, I appreciate it, Brittany. Yes, our website kind of breaks down the next set of questions, which is if you're super excited and you want to learn more, or you're ready to make an appointment, all of that is all on there now. If you haven't been in a while, you need to visit and you'll see everything you need to see to guide you through, including numbers to call to answer more questions.
Yep, fantastic. Well, thank you, Dr. Kennard, and until next time.